My name is Emil, my pronouns are he, she, and they. I'm a gender fluid Filipino Australian, and I'm 29 years old and living with HIV. Well, it was the guy who I contracted the HIV from because we were dating each other at that time, and he actually called me on New Year's Day because he found out that he was diagnosed with HIV. So then automatically I knew that I was like, oh well, if you were diagnosed, I probably have it then. So it was more of a matter of waiting game because my tests were still coming out negative in the beginning. And I wasn't seroconverting at all until like February. Like I remember I had a doctor over and he was like, oh, it's glandular fever, that's fine. But I know in my head I'm like, it's HIV. But I didn't want to say it to him because he was he was a straight guy, and I could tell that he was quite conservative, so I just didn't really feel safe about talking about what's happened. And then I had to go through university, and that's where I got my first tests. And I remember the doctor was still very much didn't know how to really deal with it, because I think he found out quite early on that it was HIV. But then he just gave me a number to be like, oh, these people will talk to you about it. And then when so it was basically the HIV public health team that tried to talk to me, but then it was like I wasn't really engaging. It was like, one, I didn't really know these people, and two, I was just kind of like, cool, I know it now, I'll just deal with it when I have the time to deal with it. But for me, it was like such sloppily handled that I'm like, I don't really feel like this is the diagnosis. So I actually went to a peer testing clinic called Rapid that's run by Queensland Positive people in Queensland, and that's where I got tested for those rapid tests, and you get your results in like 20 minutes. I think here there's Pronto for Thorn Harbour Health. And yeah, that's when I found out through a peer worker there that I was HIV positive, like officially. For me, that's where it's kind of like, okay, this is my diagnosis. Yeah. It was more of like, okay, cool, I know undetectable exists, I know people on treatment cannot pass on the HIV, and that for me was just like, great, I can still be a slut, so that was fine. But there was so much more to being HIV positive than just having your sexual citizenship. I think I've met a lot of people through this too, but because I was actually volunteering for the Queensland AIDS Council at that time, which is now called the Queensland Council for LGBTI Health, or QC. So I had a lot of understanding about HIV. Like I was one of those people who were in the clubs telling people about, how to prevent HIV. So I guess being in the coalface and then suddenly contracting it, it was like a mixture of emotions. Because one, I felt I failed. Two, I felt really guilty about it because I'm like, oh my God, I'm the one preaching it out there and how to prevent it and how to protect yourself, and then I'm the person contracting it. So there was like this mixed emotions. And because I suppose so much of my messaging at that time was just around prevention, but not really to a point. It's like, well, what if you do have HIV? How do we talk about dealing with an HIV diagnosis, and what is the reality of living with HIV now, which I think is really kind of like taken out when we talk about prevention, because that is integral to part of it. So yeah, it was hard. It took me a couple of years to get to a point to genuinely accept that I was HIV positive. HIV is an important issue because it does affect everyone. It's something that affects even those people living without HIV, because the fear that you experience hearing or being exposed to HIV is still very much present. In so many ways, if you are living with HIV, particularly for migrant populations, Asian communities, heterosexuals, people historically who have not been represented, unfairly so, but the HIV movement, I think, still needs so many resources and support. Particularly for people in my communities, like migrant folks, migration is still a massive issue. Accessing to quality health is still the number one as well. If you're fearful of HIV, I guess for me, what I've learned and the people that I've met too is that you're actually so far from alone. There's so many of us here, and with such a diversity of us, from straight folks, trans folks, colored folks, every ethnicity, every color, people have HIV. So know that within your own communities, you have people just like you. And I think when you really try and find us, we will be there for you once you're ready to connect with your community.